So in fact today is very crucial day to all of you. Since so many weeks we were completed the most of the acupuncture points and their locations and their properties and their qualification and the characteristics and their significant role. But today, since studying same thing every week, today how we need to be select as a clinical practice to implement in your day-to-day, situations and illnesses, how we can able to handle and treat the patients or the self at home also. So here you need to understand, in general, the selection of the treatment points is based on the multiple uses and action of the various points. They can also be used locally to treat the specific conditions, to reduce the inflammation in that particular area, or distally, which are often chosen based on the broader acupuncture theory system. So before selecting the acupuncture points for the treatment, the diagnosis should have been established. This includes the methods drawn from the utilizing the traditional Chinese medicine diagnostics examination, such as is the tongue and then pulse diagnosis. In fact, this is the key to understand about the most of the pathological conditions of our body. But however, so this is still I wanted to teach you what exactly the reading of the tongue, knowing about the tongue, what are the different characters of the tongue. So this certainly I will enlighten in future. So how you can able to identify the pattern of sufferings by looking tongue diagnosis. We all know there is an inspection, auscultation, percussion and palpation. These are the 4 pillars of investigation in normally. So among them, so we wanted to know what is the inspection. By looking we can able to identify the sufferings. So tongue is the mirror of the heart. At the same time, it gives a significant role because of the tongue also different kind of the internal organs illness reflect on the tongue, and then coatings and the different markings and different cracks, etc. So certainly the thickness and the thinness and then dryness of the tongue, it executes what exactly it is existing within the body system. Number 1. So later on we will look into that. And secondly, there are the other concept which we call as the pulse analysis. So this has been originated around thousands of years ago, and our ancient people were diagnosing where there is were existing about the machineries or something related to the technology, could not able to identify earlier. So those from that time, even our father of the medicine and then father of the acupuncture, father of the Ayurveda, father of the surgeries, right? All these the ancient medical practitioners were diagnosed by using the pulse diagnosis. So therefore you understand the pulse is the key to understand, because there is anything the internal organ having the deficiency or the malfunction, so that clinical manifestations are executing and existing and it representing on the radial artery. So therefore, so this is the in fact, so every segment we need to divide it into 3 segments of the each wrist. So therefore we wanted to know the upper segment related to the upper geo, the middle segment related to the middle geo, the lower segment is related to the lower geo. It indicates these are the upper pulse. So this indicates is the upper segment is belongs to the lungs and heart system, whereas in the middle geo belongs to the middle cavities like spleen, liver, spleen, liver, at the same time stomach, and then related to the pancreas. When we look at to the downwards portion, this segment, lower segment to be called as is the lower geo, where the renal system, where the kidney yin and then kidney yang, and then intestine and then extraordinary food organs are existing on the lower segment. So this analogy can be detected. So if there is the internal deficiency, certainly that will come to know. So due to that reason, the pulse in itself it signifies all your sign and symptoms. In fact, today as per my perception, about the 80% of the diseases can be identified without any investigation most of the times. Of course, there are the complex and there are the malignant conditions or certain, the new complex diseases. So we wanted to take the support of the investigation by doing the blood investigation, X-ray, CT, MRI, PET, etc. But however, most of the conditions we wanted to know as a clinical diagnosis, the clinical analysis, inference diagnosis, tongue diagnosis, skin diagnosis, the facial and auricular and lips diagnosis, abdominal diagnosis, right? All these things, it gives the immense knowledge to understand about the pathological defect within existing in our body. That's what we are doing in our centers, because so most of the times, I hope so, very rarely I used to write the investigation to the patient. But however, we wanted to know certain complex diseases. For instance, the person is coming from the corporate levels, but he wanted to know what exactly it's happening on the cervical region. If the person is suffering for the cervical pain, we would like to know that easily. So that is related to the perhaps it is C4, C5, C6, C7, C8. Among these nerves, there is kind of the rigidity or compression in between the vertebrae, which causing the rigidity on the muscles in normally. So therefore, we try to focus and treat to that muscles and treat to that particular nerve to get the relief without taking any investigation. But however, he wanted to know that the proper identification, certainly they can go for the MRI or CT or the X-ray can be recommended. But however, the traditional Chinese medicine executes that if there is a problem on the cervical region, so look at this angiomeridian pathway, look at the small intestine is the reason to cause the cervical pain, and then triple warmer is the reason to cause the cervical pain, then gallbladder is the reason to cause the cervical pain, urinary bladder is the reason to cause the cervical pain, right? Dumai meridian is the reason to cause the cervical pain, Huato Chiaji is the reason to cause the cervical pain. So we would like to know, based on the traditional perspective, which meridian is affected and which pathway is the retention or stenosis, and based on that the pulse, it gives the knowledge to the practitioner, so where you need to tackle and treat without taking the MRI, without taking any investigation, X-ray, etc. So that's what really we wanted to do. But however, today the knowledge and today the science behind the any practice, but therefore in that condition certainly we also sometimes is required some investigation data. But however, we all are belongs to the traditional practitioner, so therefore traditional medicine is totally, it is not related to the machineries, it is related to the ancient system, so it is related to the natural system. So therefore, which we need to understand, the pulse is Ayurveda says is the Vata, Pitta, Kapha. So the whole category of the diseases can be divided into three segments. Therefore, even today in acupuncture I can say, so no system will diagnose among the 12 pulses but except acupuncture. We would like to see, and normally there are the 12 different internal organs which is existing in our body. So the 12 organs are corresponding on the radial artery. There are the radial artery, generally they say in the only one to understand about the rapid pulse or a slow pulse or the higher temperature pyrexia conditions, or in this way. But however, acupuncture, it gives the whole knowledge about our each and every internal organ. So the stomach energy is deficiency, then you understand your muscular system also deficiency, your digestive system also, it is very vacuity condition. So in this way, so this is in fact is very crucial. But down the line, certainly when I take the pulse diagnosis, and precisely I will try to teach you in the offline class so that everybody is here to understand properly, right? At the same time, seeing to others also very crucial to understand about the pulse. So hopefully this will going to learn, because this is without learning the pulse diagnosis and then tongue diagnosis, this will not be fulfilled by the treating the patients, right? So this is in fact is very important. Without diagnosing, certainly we can using the needles, but somehow the patient also feels somewhere it is lacking of the treatment, and we also feel without diagnosing we are treating to the people. However, the patient will be all right, but sometimes, but still the diagnostic part is the science and evidence based medicine called as a diagnostic part is very important.